Hey guys, Dr. Sam here from Huntline Dental Group and Smileline Design. Today is all about poor fitting dentures. If you want to know what the number one way to lose bone on your upper jaw with a denture is, today we're going to dive into it. So the number one thing that I see that absolutely destroys upper bone is this exact scenario right here. Let me turn on the pre-op scans. We have a patient that has an existing upper denture and lower front teeth. So this is the scenario. We've kept those lower front 5, 6, 7, 8 teeth, and we have an upper denture. And when we bite, we can only chew with our very front teeth, which is opposite of what we'd like. We'd like to be able to chew with back teeth, but we don't have those. So when we push down to bite, this denture flexes up into this space. And look what has happened to the bone, guys. There's absolutely zero bone under the nose. In the upper jaw, little anatomy review, we've got sinuses over here that are air. We've got sinuses over here that are air. So we don't have a ton of bone back there to put implants into. And I'm going to tell you right now, if you don't have the bone underneath your nose, you're just not a candidate. And it gets harder and harder to keep this denture fitting well. So the number one situation that destroys the bone is those lower front teeth with that upper denture. What's the solution? The best solution I can come up with for patients when I see a situation like this is to build them a denture that fits. This denture, when she bites, completely rocks. It doesn't resist the bite at all because it doesn't fit. If we look underneath the denture, we can see the discrepancy between the bone up here and the actual gum tissue. There's just 5 millimeters, 6 millimeters of gum tissue here where this denture is just compressing as she bites down. So getting a better fitting denture, and the key here is getting lower back teeth. Once we can get lower back teeth back, then we can chew in the back instead of the front, and that flexion, you can see all this space up here that this denture can flex into as it rotates up and back as you're biting. The flexion of that denture goes away because we can chew on our back teeth. So what we do is there's a nerve on the lower jaw. We put anchors into the front of the lower jaw and we build you a complete set of teeth that are completely supported by implants. So this is going to be our new arrangement. We'll have an upper denture that's holding these upper teeth, and the lower teeth will be rigidly supported. They don't come out of our mouth by implants. And this is the best solution because it takes those bite forces and puts them back across where we actually have bone and stops pushing that denture into the front where we're resorbing the bone. If you want to lose all your bone, just keep putting up with that poor fitting denture. If you want a solution, give us a call and let us do a consult workup for you. Let us do an actual design where you can see if you're a real candidate for something like this before it's too late. Thanks, guys.